Welcome to a webinar on verifying non-Social Security benefits. There are 6 learning objectives for this webinar. First, to understand the importance of verifying all benefits a person receives. Second, to identify some non-Social Security benefits that need to be verified and the specific information you need to verify. Third, to describe options to verify non-SSA benefits. Fourth, to detail how you can resolve any discrepancies that may exist between the benefits verification that you get from official sources and information you get from other sources, such as the beneficiary. Fifth, to list some methods to document the benefits verification you've received. And sixth, and finally, to identify when and how often benefits need to be verified. So why do you need to verify benefits? Because, quite simply, you can only provide accurate benefits advisement if you're certain you know which benefits a person gets. Because the impact of work on different benefits is very different. If you think that a person is getting one benefit and they're getting another, you may give them the wrong advice about how work will affect their benefits. It's very easy without official verification of benefits to assume that people are getting different benefits than they actually receive. This is especially complicated by the fact that many people aren't sure which benefits they get, or even worse, they are sure which benefits they get, but they're wrong. If you rely on people's verbal reports, then you may be assuming incorrectly that people are getting a benefit that they think they get, when in fact they're getting a different one. If you are assuming that a person is getting a benefit other than the one that they're getting, you'll be explaining a different set of work rules and misinforming them. And the person could make decisions based on erroneous information that you've given them that would cause them to lose benefits they thought they were going to keep, or having benefits reduced more than they thought they would be while they're working. And that could destroy your credibility and negatively affect the person and their feelings about work. So other than benefits from Social Security, which benefits from other agencies do you need to verify? Really, you should verify all public benefits that a person gets that may be affected by work or a change in earnings. However, this training will not address all of those benefits, just some of them. So some of the non-SSA benefits that you may need to verify include Medicare, which you can contact Medicare, part of the Centers for Medicare and Medicaid Services, also known as CMS, to verify. Medicare savings programs, which include the Qualified Medicare Beneficiary or QIMBY program, the Specified Low-Income Medicare Beneficiary or SLIMBY program, and the Qualifying Individual or QI1 program. You can verify these benefits through the Missouri Department of Social Services or DSS. The Medicare Part D Low-Income Subsidy, which you can verify through Medicare or CMS. Moe Health Net, which is based on disability. There are other ways to get Moe Health Net, but the Moe Health Net categories that are based on disability include aged, blind, and disabled non-spend down or spend down Moe Health Net. You'd verify that through DSS. The 1619B rule, which can be verified either through Social Security or DSS, and Ticket to Work Health Assurance, TWHA, which can be verified through DSS. 3 other ways to get Moe Health Net that are based on disability are supplemental nursing care, SNC, which DSS can verify, supplemental aid to the blind, or SAB, and blind pension, or BP, and DSS can verify both of those as well. So what do you need to specifically verify if a person gets these other benefits that are not administered by Social Security? Well, you certainly want to figure out the which benefit the person is getting. You also want to figure out whether the individual is getting a benefit or the household. There are some Medicaid, also known as Moe Health Net, categories that a household receives rather than an individual. But the categories of Moe Health Net that we've just looked at on the previous slides are for individuals. The specific benefit type a person is getting, for example, if they're enrolled in a Medicare savings program, which one is it? QIMBY, SLIMBY, or QI1? You want to verify the amount of any cash benefit they're getting. You want to verify the amount that the person or the household might be paying for expenses related to the benefit. For example, Medicare premiums or Ticket to Work health assurance premiums. You want to verify the date that the person or the household enrolled in the benefit or had their last redetermination, and figure out when their next redetermination is supposed to happen. Now, details about which information to verify you can find in an accompanying document called Verifying Non SSA Benefits Chart. That's available to you, and that chart looks like this. It's just a hair longer than a page. It provides the benefit types we're covering, what you should verify, and how you can verify it with each type of benefit. So this is a chart you want to have available as we're going through this webinar. So there's some exercises that you'll use the chart to get answers to. So how can a person verify benefits administered by DSS? Got a few options. Can do it online at mydss.mo.gov. To verify benefits online at this site, you need to have the person's date of birth and either their Social Security number or case number. But it's important to note that information on mydss.mo.gov is not always completely accurate. So you'd want to also make sure that the information you get matches information from other sources, such as benefit award letters or verbal information you get from the individual or a worker. Now, if the information on mydss.mo.gov doesn't match the other sources of information, individual, a worker, a benefit awards letter, then you want to call the FSD information line. That's 855-373-4636. But beware that the FSD information line often has long wait times to get through to a person, and the FSD information line staff can only speak with the individual or an authorized representative. So if you call the FSD information line and you're not an authorized representative, then you'd want to be sure the individual was on the line with you. Maybe you could do a three-way call. Third, you could look at documents that the individual is able to provide that they've received from DSS, such as award letters or redetermination notices. But it's really helpful if you can also verify online or through the FSD information line. So how can you verify benefits from Medicare? Well, Medicare Part A, hospital insurance, and Medicare Part B, which is medical, outpatient medical, and doctor services, can be verified with a BPQI, a benefits plan inquiry, or a copy of the Medicare card by calling the Medicare line at 1-800-MEDICARE. Or if a person opens a My Medicare account at mymedicare.gov, you can get the information about their enrollment in Part A and Part B through the My Medicare account. Medicare Part C, also known as Medicare Advantage plans, these are a way for people to basically hire a private company to provide most or all of their Medicare services through an HMO, Health Maintenance Organization, or a PPO, a Preferred Provider Organization. These are entirely optional. You can verify this information at 1-800-MEDICARE or through a My Medicare account. And Medicare Part D, these are the prescription drug plans, which people can choose from dozens of different private companies that administer Medicare Part D prescription drug plans. You can verify it through 1-800-MEDICARE, through a person's Medicare Part D prescription drug plan card, or through the My Medicare account. And the Medicare Part D low-income subsidy, which is also called Extra Help, can be verified at 1-800-MEDICARE through a low-income subsidy enrollment letter or a My Medicare account. So let's go through an exercise involving Medicare, Medicare Savings Program, Medicare Part D low-income subsidy, and Moe Health Net. This is Mahmoud, who receives the following benefits: Medicare Parts A and B, Medicare Part D, Slim B, Part D low-income subsidy, and Ticket to Work health assurance for his Moe Health Net. What you want to figure out is how would you verify each benefit? And you can use the chart in order to do that. So you can go ahead and pause the webinar here, look at your chart to see how to verify each of Mahmoud's benefits, and then return to the webinar with your answer. And the correct answers are for Medicare Parts A and B, could be the BPQI, copy of the Medicare card, calling 1-800-MEDICARE, or through a My Medicare account. For Medicare Part D, also 1-800-MEDICARE, copy of the Part D prescription drug card, or through My Medicare account. For Slim B, go to mydss.mo.gov or the FSD information line, particularly if the information from mydss.mo.gov does not match information you've gotten from other sources, like the individual or award letters. You can use an award letter, a redetermination notice, call 1-800-MEDICARE, or use the information from a My Medicare account as well. For the Part D low income subsidy, you can call 1-800-MEDICARE, use an award letter, or get information from the person using their My Medicare account. And for Ticket to Work health assurance, since it's a DSS administered benefit, you can do it online through mydss.mo.gov or the FSD information line, particularly if the online information at mydss.mo.gov conflicts with information gotten from the individual, an award letter, or a redetermination notice. So what happens if you get official verification of a benefit and it conflicts with information from other sources? Well, you don't want to assume that one source is correct and the others are wrong. You want to verify this for sure. So if you find that there are conflicts between one source of information and others, then you want to start piecing things together to see what information is actually accurate and what's not. So you get official verification, compare that to what the person or the head of their household told you about benefits and benefit amounts. Does the information make sense based on program eligibility rules? Looking at the person's income, their resources, their other circumstances, their living arrangements, does it make sense that they're getting the benefits and benefit amounts that they told you or that the official benefit verification told you? What makes more sense, right? Now, is some of the information perhaps out of date? Maybe the person told you something about an older benefit amount and the official verification gave you a more updated amount. Does the official verification make more sense that way? Is there some information missing? But if you do see a discrepancy, you do want to check with multiple sources to verify it and try to reconcile the differences. Now, when you verify benefits, you want to keep a record of the verifications. And that could be keeping copies of the BPQI, award letters, verification letters or forms, recertification letters. If you're verifying benefits at mydss.mo.gov, maybe you could keep screenshots. You could take contact notes when you call the FSD information line or 1-800-MEDICARE to document what the person on the line told you. Is it enough to verify benefits once? Sometimes it is if you're doing very time-limited benefits advisement and you're not going to be doing anything further. But if you're going to be advising people over a period of time, or if you think they may return for more information from you, then it may be important to verify benefits periodically, not just a one-shot deal. Because sometimes benefits change over time. So if you do verify benefits periodically, you want to verify any new benefits the person has received since the last time you were in contact with them. You want to verify any benefits that have stopped that you weren't expecting would stop. And you want to verify benefits, even if they've continued, if the verification you have is out of date. Generally, if it's over 6 months old or if it's from a previous calendar year. Usually a good idea to verify benefits at least once a year. It's good to verify benefits again if a person's earnings change and their eligibility for benefits or the amount of benefits they've been receiving might have changed as a result. If the person tells you their amounts have changed or that they've gotten new benefits, you want to verify those. So let's summarize. What is your role as a benefit navigator or a benefit planner regarding verifying benefits from other sources other than Social Security? Well, if you're either a navigator or a planner, you definitely want to verify all public benefits the person receives that you'll be providing information about, especially the ones that we've covered so far in this webinar. Either a navigator or a planner can use the methods that we went through that are documented in the chart to verify benefits and then again re-verify them if necessary later. If you're a navigator or a planner, you always want to resolve any conflicts between the benefits verification you've gotten from official sources and information you've gotten from other sources such as the individual or their representative payee. And this ends this webinar. Thank you very much for participating.